the actual quantities of supplies that we have brought into the region. And my team has actually prepared the actual items that were here and taken it right back to 2021 and 2020 and 2021. So in 2020 and 2021, we brought in a total of 96 metric tons of emergency medical supplies, and we were targeting 600,000 people. Now, one unique thing that we do as WHO is that we make sure that these very supplies you are seeing here, we arrange for them to actually end up at the actual clinic or the actual hospital. We don't just bring them here, leave them here in this warehouse, and then try and see how they'll get to the facilities. We make sure that they're actually delivered there, what we call the last mile delivery. So when we say that supplies are here, we are guaranteeing that they will get to the health facilities. Then in 2022, it was a total of 207 metric tons of emergency medical supplies. And again, we ensured that there was last mile delivery up to 96 health facilities. When we say health facilities, we mean all types of health facilities. And then here in 2022, we even did better because we were targeting 2.2 million people. And it's very important to note that we also brought in medicines to treat malaria. I know we have a problem with malaria in the region. So in 2022, we had already started making sure that our population that was affected with malaria actually got treated. Now let's come to this year, 2023. And we're getting better all the time. So we are only at the beginning of August, but already we have brought in 250 metric tons into Tigray, and half of these are actually for Shire, so that populations in the northwest and the central zones also benefit. So now we are looking at getting to 4 million people that will need these supplies. So what do we have? If you look around here, we have malaria treatment for more than 190,000 cases. So if someone has malaria, I think as WHO, we are there to actually make sure that people actually do get cured. Now, you know around us that we are having cholera outbreaks, so we don't want to be unprepared in Tigray. So if you look over there, those wooden frames and wooden boxes that are there, that's for cholera. So we want to set up the treatment sites, have the medical supplies all ready so that we do not get taken unawares if cholera should strike. And part of the cholera kits, it's also tents. So they're quite bulky, that's why it looks like that. Then, let's not forget children with severe acute malnutrition. If you look over there, huge bulk of boxes starting from where we are, going all the way to the back. That's to treat any children who may have malnutrition, and we're targeting 3,000 cases. We also are aware that under very stressful conditions, a lot of us may actually have mental health problems, stress. We need psychosocial support, and sometimes we actually need medicines. So we've also brought in medicines for mental health. And we actually have so much of these medicines that we are confident that we'll be able to supply 40 hospitals until the end of the year. Then, let's not forget our colleagues who've got non-communicable diseases. So, non-communicable diseases is the new name for chronic diseases. And what most of us know as chronic diseases is your high blood pressure, your diabetes, your heart disease, and so on. So we have actually brought in anti-diabetic medicines for more than 10,000 patients until the end of the year. So 2023 is taken care of. Then, COVID has not gone away. Let's not be fooled. Just because it's no longer a public health emergency of international concern doesn't mean we should relax. Anybody gets COVID, we should be actually in a position to actually treat them. And you remember from the COVID peak that oxygen was key. It still is. If someone has COVID, we still have to make sure COVID. And you can see those cylinders right behind you there. That's all oxygen cylinders, so also ready for dispatch. So we don't just supply medicines. You know, when people are in hospital and at a health facility, they need to be monitored, right? They need to have their blood pressure checked. They need to have their temperatures taken. And we also have what we call pulse oximeters. I don't know if people know what they are. You should, if you don't, go and look, because they're there and they're a very essential part of patient monitoring. And then we even have the more sophisticated monitors. So you tend to see them in the movies, or you see them on TV. So we've also brought those into the country. Then we brought in infection prevention and control supplies. That's a whole package of what we call IPC. And then wash supplies, water and sanitation hygiene. We've brought those to take to 244 health facilities here in Tigray. And as I'm talking to you right now, distribution is actually ongoing. So that is us as WHO managing that distribution, making sure it's getting to the health facilities. But we also distribute these supplies to NGOs and other partners, because they may reach areas which we are not able to reach. And we also work with IPSA and government for the drug supplies that they have, because we now have the means to distribute them. For instance, we support the distribution of antiretroviral medicines for people with HIV and AIDS. We also distribute medicines for TB from Addis Ababa to Tigray. And we do the same, like what we do with ours, it's last mile delivery. So WHO out there in action. Thank you.
Thank you so much, Dr. Dlamini, for coming all the way from Addis to Mekelle. And Marjorie, Dr. Michael, Dr. Balai, and all the WHO staff here in Tigray. We really thank you so much for being with us during moments of crisis, and it really means a lot for our people. You have continued your support to the people of Tigray, and what we're doing today is continuing what you've been doing over the past years. So on behalf of the people of Tigray, I would really like to express my heartfelt gratitude. Thank you so much.
To date, we have been able to open 5 field offices here in Tigray. We have the major regional office in Mekelle. Then we also have an office in Shire. We have also opened an office in Adigrat and Maicho and also Aksum. And we have also ensured that these offices have enough human capacities to support all the operations that WHO is currently undertaking. We are also working, as usual, hand in gloves with the Tigray Regional Health Bureau to support them in the various interventions that are being done to support the people of Tigray. We are currently in a phase where we are working on cholera preparedness. We are aware of the cholera cases that are increasing in the various other areas within Ethiopia. And of course, as Tigray, we are also supporting the preparedness and also the response capacities. As you will see today, we have a number of supplies that we have brought into Tigray to support the cholera preparedness and response interventions. However, as WHO, we do not work alone in silo. We work together with also other health cluster partners, as we are the cluster lead agency for health. And we are also working with various entities, not only here in Mekelle, but also in the other areas that I've mentioned, which are Shire, Adigrat, Aksum, Maicho, and other areas where we do not have a permanent presence. We are also very grateful to the support that we have been receiving from various donors in the country. We thank you so much for the continued support to ensuring the lives of people in Tigray are healthy and their well-being is supported. We thank the various donors we have. We also thank the various embassies that have been lending a hand to the people of Tigray. And we also thank globally WHO, our headquarters, and our Africa Regional Office for all the support that they've been providing us. Thank you so much.
Thank you very much. I don't know if I'm audible. Can you hear me right at the back? Because I don't want people in the corners having little conversations while we're at this auspicious occasion. So, Your Excellency, Dr. Emmanuel Haile, you are the Tigray Regional Health Bureau Head. I give you our warmest greetings, and we are most honored that you've been able to join us at this inauguration. You really are a very, very special guest. Thank you. Then, Your Excellencies, the representatives from the other UN agencies, and from partners, and from the INGOs, you are also very, very welcome. And like I said before, you know, everybody's so busy, but you managed to leave your laptops, leave your work in the field, and here you are with us. And to us, that really shows that you are with us, and we are all striving for the same outcomes. And to my colleagues, the WHO counterparts, I don't know what to say. You know, you have been such stars. You have been going through these times, and here we are today. We really need to celebrate this big occasion now. And then all distinguished guests and all other colleagues, and very, very warm good afternoon. So, you know, the team has been so gracious and prepared some speaking notes. So I'm going to be gracious in return, and I'm going to read the notes. Thank you. So they're saying, remember I'm speaking for all of us, that we are gathered here to celebrate a significant milestone in the journey of WHO in Ethiopia. We are here to inaugurate the new WHO Ethiopia hub office based in Tigray, which not only provides a bigger and more work-friendly environment, but it also signifies the remarkable growth and progress we have witnessed in the past 2 years. When we look back to where we started, it is truly outstanding, and outstanding to see how far we have come. Just a couple of years ago, our team consisted of only 8 individuals. Can you imagine? 8 to what you see here? Who were working to respond to the health needs of people in the Tigray region. Today, I'm so proud to announce that our team has grown to over 78. That's the latest number. I got it this morning. 78 passionate professionals, all committed to timely and effectively respond to various crises in the region. This expansion in our staff numbers has been driven by the ever-increasing demands and challenges that we face in the field of public health. The Tigray region has encountered numerous health emergencies and crises requiring a robust and agile response from WHO. Whether it be disease outbreaks or humanitarian needs, our team has been at the forefront, working to save lives and protect the health of the people. This inauguration of this new office is not just about the physical space, which I'm sure we all appreciate. Even the finishings of this building, I was like still, you know, looking left, right, up, and really, really impressive. It also talks to mental health and well-being, doesn't it? Yes. When you're in a space like this, you know, you can't say. Yeah, so really, it's really kudos to the team for identifying this building. And of course, we'll be better able to serve the people of Tigray. As we embark on this new chapter, we recognize the immense responsibility placed upon us. The challenges we face are complex. I don't have to remind anybody about that. But we are so confident in our ability to overcome them. We will, of course, continue to work closely with the Regional Health Bureau, our partners, the local communities, and other stakeholders to ensure a coordinated and comprehensive response to health emergencies. So before I conclude, I say once again that today is a day of celebration and gratitude. We express our deepest appreciation to all the dedicated staff members who have worked so hard to make this expansion possible. We extend our heartfelt thanks to the Tigray Regional Health Bureau, and of course to you, Dr. Manyo, and please, if you can take back this message to all the colleagues at the RHB. Thank you to our partners, thank you to our supporters who've stood by us in our mission to improve the health and well-being of the people of Tigray. Together, we will continue to strive for a healthier future, leaving no one behind. Now, I cannot end the speech without also mentioning why this is especially also an important occasion, chronologically speaking, because it should go down in our records that we moved into this office during 2023, the 75th anniversary of WHO. Happy birthday to all of us. Look here, we've got posters with someone, you know, all. Yes, 75 years, that's WHO. So with all these thoughts in mind, let us embrace this new office as a symbol of our commitment to the people we serve, and let us work hand in hand to achieve our shared vision of a world where everyone enjoys the highest standard of health. Let us move forward with renewed dedication and determination. Thank you, thank you, thank you.
I think Kenneth is right, OCHA, because we have the institutional memory of the entire situation in Tigray, and we've gone through a lot, but not only us, including WFP, WHO, UNHCR, and all the other UN agencies. It's been a very difficult time. When Dr. Emmanuel mentioned that what we've gone through and where we are today, I think we have achieved a lot. And thanks to the peace agreement. Because of the peace agreement today, we have moved to this very big office. Last year, we would not even think about moving to this office. Last year, I remember seeing Dr. Michael Mwanda on the corridor looking for internet. Not only him, almost all the staff struggling to get internet. We also remember when we had the trucks full with drugs and medical supplies waiting in Samara to come into Tigray. That was one of the most difficult times. We go to the hospitals, we see children, we have drugs and medical supplies in Samara, but we cannot get it across to them. Dr. Our rep, today I want to inform you that WHO, when we visited Rama, the hospital in Rama, the medical director informed us that WHO have been able to deliver drugs that will last them for 6 months in Rama. Not only in Rama, I also want to inform you that when we were in Adiawala, Adiawala is the border to Eritrea. We're talking about Adediabo and Shiraro Waredas. WHO have been able to reach the affected population there the health facilities there with drugs and medical supplies. So I think this, sincere apologies. So the achievement we have seen today is all as a result of the peace that we have today. And also special thanks goes to the regional government. I will start with His Excellency, the regional president, Getachew Reda, who has been very, very supportive to the humanitarian community. And in particular, Dr. Emmanuel, who has been with us right from Ida Hospital. And as you can see, he is moving higher and higher and higher. Hopefully, tomorrow he will move to another higher position than where he is, simply because of his commitment and dedication to serving the people of Tigray. And in particular, his commitment to serving the affected population. So, Doctor, I will not take the whole 30 minutes. I will want to thank WHO for participating in all the coordination platforms. Right from the zonal coordination platform in the fields, I was talking to Doctor on the zonal coordination platforms at the zonal level in Abiadi, in Adigrat, in Shiraro, in Mekelle here. The zonal coordination is the platform where we reach the affected population. And WHO have been very instrumental in this zonal coordination. And we want to strengthen this coordination to ensure that we reach the affected population in the zones. Because from the zonal coordination, we can reach the people in the Kabeles. But at the moment, we still have areas that are very difficult, very hard to reach areas. And you not only being the rep, because you are also the member of the HCT in Addis. OCHA will always seize this kind of opportunity to ensure that we flag our mandate on advocacy. We need to reach these people in hard-to-reach areas. When I mean hard-to-reach areas, we want to reach people in Alitena. We want to reach people in Dalgeda. We want to reach people in Gemhalo. We want to reach people in Adiabai. We want to reach people in Maisabri. These areas, we are still struggling as hard-to-reach areas. Grateful if you can pass this advocacy for additional security for protection of civilians. Sorry, Kenneth, if I'm touching into your the UNHCR area, but protection of civilians in those areas is very, very paramount to us, and we really need your support. Closely related to that also, we need more resources because we have very huge caseload in Tigray. The caseload in Tigray is more than any other region. The IDPs are still in IDP camps. They cannot return, for example, to Western Tigray because of issues regarding security and political issues. However, we need to provide support for them in Tigray so that most of them who are now in schools can move out of the schools so that children can go back. Most of you here will agree with me that the children of Tigray have been out of school for more than 2.5 years, COVID plus the conflict. But we still have more than 106 schools that are still hosting IDPs. So returns and relocation is one of our major priority. Closely related to that, you also know the situation of food. I don't want to go into that, but the impact of the food pause is having serious negative effects on the affected population in Tigray. We have several negative news that is coming out as a result of this food pause. We really, really need your big platform of HCT to advocate, because the food pause started in Tigray. So we should start getting food in Tigray now that we have put certain measures in place. So, one minute. So, I will not take 1 minute. I will take 1 second. So, Madam, thank you for coming. I know you've been here several times. You came with the RCHC the last time, and we have you here today, and we will see more of you. Now with the big office, we expect also to see more. Again, Dr. Manuel, also thank you for your presence here. We really appreciate. And also the WHO team, Dr. Mahari, our health cluster coordinator, Dr. Mwanda, Majorin, and the rest of the team. Thank you.
And Dr. Emanuel and other partners, we are very pleased to be hosted here, and we are very privileged to be here to say welcome and congratulations for your new office. World Vision has been a good partner with all UN agencies, INGOs, local NGOs, the local communities where we have been operating, especially in the 6 zones of Tigray, including the south. So we have been partnering with all UN agencies and INGOs and faith-based organizations, and even during the hard times. So while we just congratulate having this opportunity, we would also like for you all partners to expand your operation, your partnership, your coordination and collaboration, so that to reach the conflict-affected community of Tigray, especially the hard-to-reach areas where OCHA colleagues have been mentioning, very hard-to-reach areas, still communities are at risk. So we will continue to partner with you, and also we would also like to, for huge advocacy for Tigray. While we are fortunate to have you to work with, we are also unfortunate for Tigray now that after the siege, many funds were expected to come in. But unfortunately, no, because the world and the international community has diverted its attention to the Ukraine and the Sudan crisis, and also the suspension of food aid is also of huge significance. So now the Tigrayan people were expecting a huge support, but things are going in the otherwise. So I would like to call upon your advocacy to support the Tigrayan people. We will work together, and we are happy to be hosted again. So thank you very much.